There is a silent enemy that advances without making a sound, without fanfare, and that strikes an impressive number of men: prostate cancer. The hardest truth about this condition is that it operates in the shadows, and when the signs become obvious, the battle can be much more difficult. Now pause and reflect. Has your body been sending you messages that you've been ignoring? That difficulty urinating that you attributed to age, the constant need to go to the bathroom even at night, or that dull ache in the pelvic region that won't go away. These are not just simple passing annoyances. They are critical warning signs. Your body screams for attention. It's a heartbreaking fact. Thousands of men lose the battle every year simply because these precious warnings were neglected or arrived too late. This is your turning point. What you are about to discover are the early signs that the vast majority of men are unaware of or are afraid to face. This is not just a conversation, it is a non-negotiable investment in your most fundamental well-being. Every piece of information that follows is a step for you to take back control. If your health or the health of a man you love is a priority, then every second of this content is absolutely vital. And in a move to strengthen your defenses from the inside out, you will get access to an extraordinary natural preparation, a recipe that acts as a shield to boost your immunity. Consider this a valuable asset, an advantage you can start using today. The impact of this knowledge can be transformative, but it requires a decision from you right now. Make a pact with yourself. If you are truly committed to transforming your health and seeking a life with more energy and presence, leave your mark in the comments with the phrase, "I am light and healing." This affirmation is the first step to solidifying your intention and connecting with a community that has chosen to live more consciously. And don't keep this warning just for yourself. This is one of those rare opportunities where a simple click can have a real impact. Share this video with a father, a brother, a friend. You will never know how many lives you might be protecting by passing on information that for many arrives as a true lifesaver. Get ready, because we are just getting started. What is prostate cancer and why is it so dangerous? Prostate cancer is considered the most common type among men, especially after the age of 50. This small gland, located below the bladder, plays a fundamental role in the male reproductive system, being responsible for producing part of the semen. The problem arises when the cells in the prostate begin to multiply uncontrollably, forming tumors. Often this growth happens in a slow and silent manner, without any noticeable symptoms in the early stages. This is why it's called the invisible enemy. The greatest danger lies precisely in the lack of obvious symptoms in the early phases. Many men only realize something is wrong when the disease is already at an advanced stage, making treatment more difficult and reducing the chances of a cure. But this does not have to be your fate. Early signs and symptoms of prostate cancer that you cannot ignore. Identifying the symptoms of prostate cancer early on can save lives. Many men mistake these signs for common problems like urinary infections or aging. Next, see how to recognize the most concerning symptoms, their causes, and the best solutions for each case. Difficulty urinating. If you notice that it takes a long time to start urinating, even when you feel your bladder is full, or if you need to strain to urinate, this can be a warning sign. The urinary stream may come out weaker or stop suddenly. This difficulty occurs because the enlarged prostate presses on the urethra, the canal that carries urine out of the body. Best solution: see a urologist immediately to get a digital rectal exam and a blood test. PSA, prostate-specific antigen. In many cases, a pelvic ultrasound or an MRI may also be requested to assess the size and condition of the prostate. Treatments include medications to reduce the swelling or, in more severe cases, surgery. Frequent urge to urinate, especially at night. Waking up several times during the night to urinate may seem normal to some people, but it is an important symptom that deserves attention. The pressure that the enlarged prostate exerts on the bladder makes it feel full all the time, even when it's almost empty. Urinating frequently in small amounts is also a warning sign. Best solution: do not ignore this change in your urinary pattern. Urine tests, ultrasound, and urodynamic studies help identify if the problem is related to the prostate or another condition. Medications such as alpha blockers can relieve the pressure on the bladder. Feeling of a full bladder after urinating. If you finish urinating but still feel like your bladder is full, this can be a sign of a partial blockage of the urethra due to the prostate's growth. This constant sensation of incomplete emptying can also lead to frequent urinary tract infections. Best solution: treatment may include medications to relax the prostate and facilitate urine flow. In more severe cases, a surgery called transurethral resection of the prostate may be necessary to remove part of the prostate tissue. Presence of blood in the urine or semen. If the urine or semen appears reddish, pink, or even brown, this indicates the presence of blood. This can occur when blood vessels near the prostate are damaged due to the abnormal growth of cancer cells. Even a small amount of visible blood is a cause for concern. Best solution: see a doctor immediately. Exams such as cystoscopy, internal visualization of the bladder, and a prostate biopsy are essential to identify the cause. The treatment will depend on the diagnosis and may include surgery, radiation therapy, or chemotherapy if necessary. Persistent pain in the pelvic region, back or hips, a constant pain in the lower back, hips, or pelvic region can indicate that the prostate cancer has spread to nearby bones. This pain is usually persistent, deep, and does not improve with rest or common painkillers. Best solution: imaging tests such as computed tomography, CT scans, magnetic resonance imaging, MRI, and bone scans are recommended to check for metastasis. In advanced cases, treatment may include hormone therapy, radiation therapy, or even surgery to relieve pain. Erectile dysfunction and loss of sexual interest. Problems like difficulty getting or maintaining an erection can be related to prostate cancer. This happens because the nerves responsible for erection are close to the prostate and can be affected by tumor growth. Furthermore, the worry about one's health itself can influence sexual desire. Best solution: consult a specialist for a complete evaluation. Pelvic floor physical therapy, erectile dysfunction medications, and hormone therapy are some treatment options. Psychological counseling can also help deal with the emotional impact. Unexplained weight loss and constant fatigue, losing weight rapidly without dieting or exercising and feeling extreme tiredness for no apparent reason, can indicate that the cancer is spreading to other organs. In these cases, the body uses a large part of its energy to fight the disease, resulting in weakness and weight loss. Best solution: detailed blood tests and CT scans are recommended to investigate possible metastases. The treatment depends on the stage of the cancer and may include chemotherapy, radiation therapy, and lifestyle changes to improve quality of life. Final note: even though some of these symptoms could be related to less serious problems, don't wait for them to get worse. The earlier the disease is diagnosed, the higher the chances of a cure. Keep regular appointments with your urologist and get preventive exams every year. Prevention is the best medicine. Risk factors and habits that increase the chances of developing prostate cancer. To prevent prostate cancer, it's not enough to just know its symptoms. Understanding which risk factors increase the chances of developing the disease is fundamental to adopting healthier habits and avoiding future complications. Next, see the main risk factors and the best forms of prevention. Advanced age. Age is the main risk factor for prostate cancer. Men over 50 are more likely to develop the disease, and after 65, the risk increases significantly. How to prevent? Even though age is inevitable, it's possible to minimize the risks through annual visits to the urologist, especially after 45 for men with a family history, and after 50 for all others. Routine exams like the PSA test and the digital rectal exam are indispensable. Family history. If a close relative, such as a father or brother, has had prostate cancer, your chances of developing the disease double. When there are 2 or more cases in the family, the risk becomes even greater. How to prevent? In these cases, prevention starts earlier. Get regular exams starting at age 40 and talk to your doctor about possible genetic testing if there are multiple cases of cancer in the family. Genetic factors and hereditary mutations. Some specific genes, like BRCA1 and BRCA2, are associated with an increased risk of prostate cancer. These genetic mutations are more common in families with a history of breast and ovarian cancer. How to prevent? Talk to your doctor about getting genetic testing, especially if there are multiple cases of cancer in the family. Early detection allows for greater control and better medical follow-up. Diet high in fats and poor in nutrients. A diet rich in saturated fats, processed meats, and industrialized foods can increase the risk of developing prostate cancer. This happens because these substances cause inflammation in the body and favor the development of cancer cells. How to prevent? Invest in a healthy diet, rich in fruits, vegetables, whole grains, and lean proteins like fish and chicken. Foods rich in lycopene, such as tomatoes, watermelon, and guava, are excellent for prostate health. Reduce the consumption of processed foods and sugary drinks. Sedentary lifestyle, a lack of physical activity, contributes to the development of various chronic diseases, including prostate cancer. A sedentary lifestyle leads to weight gain and widespread inflammation, which can favor the appearance of tumors. How to prevent? Exercise regularly. 30 minutes of walking, running, cycling, or swimming at least 5 times a week is enough to improve circulation, control weight, and strengthen the immune system. Obesity. Excess weight is associated with a higher risk of aggressive prostate cancer. This occurs due to the accumulation of fat, which can cause chronic inflammation in the body, in addition to increasing the production of hormones like insulin, which favors the growth of cancer cells. How to prevent? Maintain a balanced diet and control your weight through regular exercise and periodic medical checkups to monitor your overall health. Dietary re-education can be a great ally in prevention. Excessive alcohol consumption and smoking. Excessive alcohol consumption and smoking are directly related to an increased risk of various types of cancer, including prostate cancer. Tobacco contains chemical substances that can damage prostate cells, while alcohol in excess overloads the liver and affects hormonal balance. How to prevent? Moderate your alcohol consumption and quit smoking. Seek professional help if necessary and invest in a healthier lifestyle, focusing on physical and mental well-being. Exposure to toxic chemicals. Workers exposed to toxic chemical substances, such as pesticides and heavy metals, may have a higher risk of developing prostate cancer due to constant exposure to carcinogenic compounds. How to prevent? Use adequate protective equipment and avoid prolonged exposure to chemical products. If you work in high-risk environments, see a doctor regularly to monitor your health. Preventing prostate cancer isn't complicated when you adopt a healthy lifestyle with balanced eating habits, regular exercise, and consistent medical follow-up. The combination of these actions can drastically reduce the chances of developing the disease and improve your quality of life. Powerful natural recipe to strengthen immunity and protect the prostate. Now that you know the symptoms and risk factors for prostate cancer, I will share an old home recipe used for generations to strengthen immunity and protect prostate health naturally. Its ingredients are powerful and scientifically proven, helping to fight inflammation and prevent serious problems. Recipe for prostate protective juice, antioxidant and anti-inflammatory. Ingredients: 2 cooked ripe tomatoes, rich in lycopene, which is only absorbed by the body after heating. 1 medium raw carrot, source of beta-carotene and vitamin A, which strengthen the immune system. 1 slice of watermelon, rich in water and lycopene to hydrate and protect cells. 1 small raw garlic clove, natural anti-inflammatory that fights infections. 1 teaspoon of turmeric, powerful anti-inflammatory. And antioxidant, a pinch of black pepper helps activate the curcumin present in turmeric. Half a lemon, source of vitamin C, strengthening immunity. 1 glass of filtered water or coconut water for better hydration. Instructions: cook the tomatoes. Place them in boiling water for 5 to 10 minutes or roast them lightly. This releases the lycopene and enhances its absorption. Prepare the other ingredients. Wash the carrot, watermelon and lemon thoroughly. Blend everything in a blender. Add the cooked tomatoes, carrot, watermelon, garlic, turmeric, black pepper and the lemon juice. Add the filtered water or coconut water. Blend until you get a smooth and creamy mixture. How to consume. Ideal time: drink this juice on an empty stomach in the morning, at least 3 times a week. This increases the absorption of nutrients and helps protect your health continuously. Proven benefits of the ingredients. Cooked tomato. Its high concentration of lycopene is one of the biggest allies for prostate health. Studies show that its regular consumption can reduce the risk of prostate cancer by up to 30%. Remember that heating releases the lycopene, making it more bioavailable for the body. Raw carrot. Its rich composition of beta-carotene and vitamin A fights free radicals and strengthens the immune system, preventing premature cell aging. Watermelon. Besides providing lycopene and water, it helps with cellular hydration and the elimination of toxins, being an excellent natural diuretic. Garlic. Considered a natural anti-inflammatory, it fights infections, regulates blood pressure, and reduces the risk of abnormal cell growth. Turmeric and black pepper. Turmeric contains curcumin, a highly anti-inflammatory substance. The black pepper activates the curcumin, increasing its absorption by up to 2,000%. Lemon. With its high concentration of vitamin C, lemon strengthens the immune system and helps keep the body alkaline, preventing inflammation. Contraindications and precautions. People with stomach problems like gastritis and ulcers should avoid excessive consumption of garlic, turmeric and lemon. People undergoing medical treatment should consult a healthcare professional before starting regular consumption. Pregnant and breastfeeding women should have medical supervision before including these ingredients in their diet. This simple, natural recipe can be a powerful ally for prostate health and for overall immune system strengthening. Remember that, besides consuming healthy foods, it is essential to maintain regular doctor's appointments, get preventive exams, and practice healthy habits daily. If you've made it this far, congratulations. Today you learned how to identify the early signs of prostate cancer, the main risk factors, and even discovered a powerful recipe to strengthen your immunity and protect your health. This information can save lives, so make sure to put it into practice. What grade would you give this lesson? From 0 to 10, comment down below. Your opinion is very important to me. Also, tell me which city you are watching this video from, so I can see how far this health message is reaching. Be part of this health chain. Comment here in the comments, "Life is sacred," or "I am light and healing." This strengthens your determination and helps spread positive messages. Don't leave yet. On the final screen, I will leave 2 powerful videos that will complement what you learned today. Watch them to transform your health. Subscribe to the channel and turn on notifications to be notified whenever a new lesson is published. Together, we can build a healthier and more balanced life. Much health, peace, and light to you and your family. Until the next lesson.